Do you think you have PCOS? Or do you assume you have PCOS because every other person is talking about PCOS? What are the signs that one could have PCOS? PCOS, known as polycystic ovarian syndrome, is basically an ovarian dysfunction that affects females, okay, and causes hormonal imbalance. And there are actually three cardinal signs of PCOS. The first one would be irregular menstrual cycle. So in this irregular menstrual cycle, I mean oligomenorrhea or amenorrhea. So in oligomenorrhea, it means that you're having infrequent periods or you're menstruating less than what is considered normal. Then in amenorrhea, it means that you're not menstruating at all. So either of these two is usually a pointer that you could have PCOS. The next one would be increase in production of androgens. Androgens are sex hormones that are produced by both the males and females, but they are produced in minute or small quantities in females. So they are predominantly produced by males, okay? And they are the male hormones such as testosterone. So when females produce these androgens, okay, like testosterone in large quantities, then that means that the person may have PCOS. The last one would be abnormal morphology of the ovaries. So in this abnormal morphology of the ovaries, so cysts are formed, and these cysts are basically fluid-filled sacs or pockets, okay, pouches, okay, that form in the ovaries, and this can actually be visualized when you do a pelvic ultrasound scan. Now, what is the cause of PCOS? Okay, the exact cause of PCOS is actually unknown. However, it is known to run in families, so a positive family history of PCOS can actually predispose one, okay, or increase one's chances of having PCOS. Now, we are going to discuss the symptoms of PCOS. The first one would be irregular periods, okay, like I mentioned, amenorrhea or oligomenorrhea. The next one here would be hirsutism. The females have excessive hair growth in certain areas of the body, like the face, the upper chin, okay, around the jaw, maybe they have birds, or even the chest, okay. So that may be a sign that the person may have PCOS. The next one here would be obesity. So in PCOS, there's usually this weight gain, okay, or the person being overweight, and that could show that you have PCOS. The next one would be acne. So people that have PCOS, they have increased chances of having acne on the face, chest, and maybe at the back as well. Also, they may have acanthosis nigrans. So this basically means increased hyperpigmentation or darkening in certain areas of the body, like the skin folds, okay, around your armpit, your groin area, at the folds of your neck too. So this is a sign that the person may have PCOS. Then the last but not the least would be thinning of hair. So people with PCOS may start losing their hair or even go bald. So what are the complications of PCOS? The first one is infertility. PCOS can make one to be infertile. The next one would be gestational diabetes, okay? So PCOS can actually make one to develop diabetes in pregnancy, okay, that is the gestational diabetes, or type 2 diabetes, which is basically when there's insulin resistance. So, under normal circumstances, the body, the pancreas, produces insulin hormone to help regulate the blood sugar levels. But in insulin resistance, the body is not responding to the insulin being produced. So the blood sugar keeps going up and up and up. So the insulin production is like shut down because the body is not responding to that insulin that is produced, that is meant to help to control the blood sugar. So people that have PCOS may come down with this gestational diabetes or type 2 diabetes. Then they also may have increased chances of miscarriages and even premature birth. How can PCOS be diagnosed? So the first one here would be doing a hormonal profile. So here, okay, the doctor or your gynecologist would be checking out, the levels of the LH hormone, the FSH hormone, testosterone hormones as well. So the checking of these hormone levels would also help the person, okay, to ascertain whether you have PCOS. Also, doing a pelvic ultrasound scan, okay, can visualize your ovaries to check the structure, if there are cysts there, and if there are any, are they multiple, what are the sizes. So like once there are cysts seen on the ovaries, okay, when you do the pelvic ultrasound scan, then that means that you have PCOS. How can PCOS be treated? First here, your fertility physician could prescribe some medications like the combined contraceptive pills, okay, for you to take to help control your menstrual cycle. Then also some other medications may be prescribed, to block off the effects of the androgen, okay, that causes this excessive hair growth or hirsutism and even acne. Again, your fertility physician may prescribe clomiphene tablets. So these tablets would basically help to induce ovulation. Another one would be lifestyle modification. So your diet, low fat, low cholesterol diets, exercising also important, okay? So here I mean the moderate intensity exercises. Weight reduction would actually improve and increase the effectiveness of the medications that you're actually going to take. Hair removal treatments like the laser hair removal therapy, okay, can help you with the hirsutism for people that have that excessive hair growth in areas of the body that can be quite embarrassing sometimes. Also, topical creams can be used, okay, to treat acne that people may have as a result of this PCOS. However, I would like to say that your gynecologist or fertility physician would be the one, to examine you, request for the right investigations or tests for you to do, okay, and give you the right treatments that you need. So do not self-medicate. And that brings us to the end of this video. Hope you enjoyed this video, and don't forget to like, comment, and subscribe to my channel. And I'll see you in my next one. Bye!